we'll start with the front. What we have the idea of is we'll look at some general anatomy of the back. As we know, we want to look at the tennis side and tennis components of it, but know that knowing that the tennis is a rotational sport, it can be correlated with other sports also, like golf, baseball, any of the rotational activities. I grew up playing cricket since I was 3, and so I find, and I picked up tennis much later in my life, but I find that I am a one-sided dominant player because in baseball or in cricket, you pick a side and you just play from that side. You're not ambidextrous. You switch and you play. And so 75% of my game on the court happens only from one side, and the other side is only like because the ball went there, I went there. That's all. Otherwise, I'm trying to make positions to become try to get the ball in the forehand. So what that does is it creates unidirectional rotational changes and overuse of one side. And that makes the spine prone to extra twisting and extra injuries. So there are ways that a rotational athlete can do to warm up the body so it's ready for what you're getting ready to do, but also cool down so all the changes, all the overuse I did from 75% on one side and not so much on the other can be normalized before it takes its own pattern during the next 2 or 3 days when I'm actually off or maybe going back to work, that those patterns I don't take with me and not let it develop and just kill it right after the course. The leg is blocked because the muscle is tight and the leg is blocked and it's not going back. It will create movement on the other end and it will cause the back to arch forward. It's going to pull from the front. When that arching happens, that lowers your lumbar spine and that creates lower back pain. It just kind of presses on your discs, it creates pressure, it changes the way how your pelvis operates, and then that creates pressure. So just relieving the hip flexors at times can just relieve the back pain if that was the only thing going on. So we'll go back. Yeah, the hip flexors will go to it, right? Yeah. So while we're talking about hip flexors, let's go ahead and do a test. It's called Thomas test. We'll look in the 4th page, but Jane, if you don't mind volunteering for the Thomas test. And so I'm going to have you come on this side of the bed, and you guys can do that at home if you would like, or use the bed later. So I'm going to have you come sit on the edge, hug one side, which let's say, hug the good side first so we can see the difference. So or rather I should say hug the left leg so we could see the good side first, and then you can go ahead and lay. Good. So what you're seeing right now, and you guys are the very good angle of looking, other than I'm sorry, you can join us this way, but so you're looking at the hip from the side, and you're looking at the knee from the side and looking at the foot. These are the 3 areas I want you to focus. And so you want the knee to be slightly lower than the hip angle. And you want the foot and the knee to be fairly relaxed, where the foot would just go back and forth and it's easy and it's not like taut. Okay? So this is a good side. Let's go ahead and slowly switch. We'll see where things are on the left. Good. So that's the resting state of her left hip flexors. And what you're noticing is that she's doing good on her knee component. But when you look at the foot is just sticking way far out. And that's a classical tightness of your rectus femoris, which is the muscle on the diagram we'll look at, and that's one of the hip flexors. And so this is a classical screening sign to see, oh, well, the left hip flexor has a tendency to talk. And it changes daily because, you know, weather's changed. We may sleep well one day or not. Things are different, so you just know which muscles you want to activate and strengthen and stretch. So in her case, left hip flexor would be one of those that you would be using as a daily practice, and stretching as a daily practice. So you can slowly come in. Thank you, James. So, any questions so far?
Were you just doing that for effect?
No, I really am that tight. So another way you can tell is that, like, one of the stretches that you do is just like this stretch. Okay, you see how easily my heel comes to my butt?
Yeah.
No problem whatsoever.
Yeah.
You look at this side.
I would say exactly.
Okay. And now I got my heel to my butt. and I'm feeling a really good stretch. So that's one of the stretches that I do every day.
So is that considered a hip flexor stretch?
Yeah, it is a hip flexor stretch, and then the other one is here. So I do that one as well. And after I do both of those, then
Are you
things
right-handed?
get better. Yes.
So is it normal to have your dominant
Yes,
side?
yes, because think about it, and everything you do, like in tennis, you plant. So this is the one that gets all the force onto it. So it's tightening up a lot more. I mean, when you come through. And so even if I'm standing at my computer typing, I will catch myself doing that, loading on this side. So it's always tighter than this. This one's always loose. This one's always tight.
Start with the finger on the floor. So, and feel free to join if you want to. So Jane, what I'm going to have you do is your feet will probably, so you want the feet to be hip width apart. So here you could have it on the borders of the plank or just two planks with the plank in the middle. And then knees as straight as you possibly can. And you can slow, control, bow, and go as far as you can. So weather and tightness is making all of us tight on the hamstrings. Not all. Look at that.
Yeah.
You guys are doing great. And come back up. Oh, you feel in the opposite. Okay. Don't push it too much. So, great job. So, the normal test is you being able to put the finger to the floor. And you were putting your hand in. So, good job. So, knees, you want the knees to be straight, and you want to be able to touch the floor. So whoever was able to touch the floor, it's a negative test. Whoever wasn't, with the knees as straight as you possibly can, it's a positive test. We both categorize there for the time being.
Do some stretching.
The second test is the slump test. You do this in sitting. So we can sit. And so this is one that can be painful. And so you pause before the pain starts. And I'll guide you through. And so the first move you do is the head down and then kind of a slump. So excellent. You just like have the worst posture possible. And you do not want to have any pain. If you have any, don't move to the next step. Okay. From here, you can slowly straighten one leg as if you're kicking it out. Yep. And that may create some lower back discomfort or tingling or numbness down the leg. And if you don't, it's negative. You do the positive pause, don't proceed. And then the last one is you switch legs and you do the same on the other. Good. And rest. All good? Good, very good, excellent. So it's a test to check how your sciatic nerve is doing right now. Is it actively talking, actively firing? Are you actively undergoing any disc herniation, disc symptoms? If you don't have any of that, which is a clear sign that you don't have any active sciatica going on, and that's